Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Hello, everyone. I am really excited for this discussion with Dr. Neil Sheth, Associate Professor of Orthopedic Surgery and Chief of Orthopedic Surgery at Pennsylvania Hospital. And today we're going to walk through the mindset that you need to put yourself into to create efficiency in all areas of your life. So Dr. Sheth is going to share his insight on how to get into this mindset. We will walk through illustrative examples about how he applies efficiency to his work and personal life, and how to balance it all between profession, being present, maybe sleeping, maybe not. So thank you so much for joining us today, Neil.
Marney, thank you so much for having me. Really looking forward to this discussion.
Awesome. Well, you have always been hyper efficient with your time. Was this something that you grew into, or from baby Neil, you've just been efficient always?
It's a good question. So, one of the things that's unique in my background is that I was an investment banker before I went to med school. And so being 22 years old and going from college to Wall Street changed things drastically. And I think that's the first time in my life I realized I wasn't great at managing my time or managing my attention and energy when I had to do a certain task. And when moving forward and made the decision to go back to medical school, I realized that in med school, the same exact skill sets that were required to be successful on Wall Street still applied. And then fast forward to residency, I'm like, God, it's the same exact thing. Regardless of what you do in any profession, I think being able to manage your time and to be effective and productive when you say you're going to be productive was really critical. So I don't think I was born with this. I think I saw a lot of this definitely on Wall Street on how it worked well, learned some of those principles, and then slowly I started to apply them through med school and residency. And it wasn't probably until the end of my residency that I started kind of really creating a good system that I kept fine-tuning over the next several years.
Let's start with work life, since I think so many of us spend the majority of our time in our careers, at least most likely people listening into these podcasts do. How do you approach, I'm going to scale this back. You said that you kind of got the hang of it in residency. Can you walk through the various stages of fellowship where your time is still not your own? You're in your first year of practice where suddenly your time is your own, and now you've got to, figure all of that out. And then as you ramp up and get busy, so the various different stages of how you created your efficiency ecosystem.
Yeah, so that's probably one of the hardest things that I talk to, I think, our trainees about, whether it's medical students or residents or fellows, or even junior attendings who are starting out in practice. I think the hard part is that as you go through your different phases, you've got varying degrees of control. And I think that when you're early on, you probably have a lot more control when you're a medical student because you're really just spending most of your time studying and you've got discrete time periods in which you have to be engaged in something and the rest of the time is yours. Residency is a little bit tougher, especially when you're on certain services such as the trauma service. You don't know what's coming in. You don't know how much time you're going to be spending on this. And you have less control during that time. And then Fellowship's actually a pretty good year to start getting into some good habits. But I'd say the hardest part is probably the first 2 years of your practice where you're trying to be available, you're trying to be able to do what you need to do, and you're in a time frame where you're not going to say no to opportunities that arise. And that's where I think things can really go sideways if you're not paying attention. I think, one of the things that you mentioned, Marney, that's really important is I know that work-life balance is a very critical sort of term right now in today's world. And this is across all specialties, right? Not just in medicine. I think it's really important to understand that the goal should really be to balance your work and to balance your life. It's not balancing one at the expense of the other. So it's not that I'm just going to keep working all the time and basically forgo my life, or I'm going to just spend my time living my life and forgo not doing my work properly. It's a balance of both. And that's, I think, the critical piece to this.
I love that. That makes so much more sense and hopefully makes people feel like they're not failing at this, fake thing called work-life balance. So can you talk to us about, you have very different settings. You've got clinic, extremely busy. Then you've got the operating room. Then you've got, especially, for you, administrative meetings, board meetings. You've got side projects like building, a hospital in a different, continent. How do you implement efficiency across these continuums?
Yeah. So, I think this is the crux of, what we should probably spend our time talking about because this is what people want to know, right? So the nice thing is that it took me some time. All right, I'm entering in my 14th year of practice, but it probably took several years before I was able to get a routine week. So in the first few years, it was hard to create a system when I'm in the operating room every other Tuesday, every Wednesday, the third Friday of the month. I've got clinics here, there, something comes in. I've got to cancel a clinic, had no administrative or academic time. So a lot more chaotic a decade ago. And I just kept whittling away at my system to come up with what would work. For me now, it's kind of nice because I've got a full day clinic on Monday, which is typically 60 plus patients in a full clinic day. I'm in the operating room Tuesday and Wednesday where I've got 2 rooms and typically get 7 cases done each day before dinner time. Thursday, I've got a full administrative day. And then Friday, I've got clinic as like a half day clinic from 9 until 2 in the afternoon. So when I think about efficiencies, I think about them in those different locales. So one of the things for clinic, for example, as I've gotten busier, is I've got specific slots set up at specific times. So for example, new patients are only booked in at the 0 hour and the 30-minute mark. So every hour I'm seeing 2 new patients an hour. In between, and everyone gets a 10-minute slot, but in between I'm seeing the quick post-op patient, a quick return patient that's coming in for their 1-year annual visit, and the person who's coming in for a quick injection that's going on a trip next week. So my assistant runs that pretty smoothly. And so I'm still able to see 16 to 18 new patients a day and still take care of a lot of the return patients that might not be coming in for another joint replacement on a different joint. The nice thing is that if I have a patient that's a complex patient, I know it's a patient that's going to take a lot of time, someone I've operated on it before, maybe they've had a complication or they've got things that they want to keep discussing that's going to take time, they'll get slotted into a new patient appointment. So I don't have 4 of those within an hour. So that actually really helps streamline things. The other thing is, during my clinic, one of the things that I think is hard is, right, you put yourself in clinic and there's things that are happening sort of in parallel. So now you're getting 800 emails that are being sent to you during the day. And then by the time you're done with clinic, you open up your email and wow, I've got 70 things that I've got to respond to that I didn't look at all day. So for me, my email is open all day during clinic. And Marney, you know this better than anyone. I've got this 90-second rule. If there's an email I can respond to in 90 seconds or less, I'll take care of it, file it, and be done with it. If not, it's something that I will flag, so I will come back to it at the end of the day. The thing that I've done, I think, on the clinic days that are critical are that on Mondays, I start at 8 a.m. My last patient is usually scheduled for 4:30. And I'm done with clinic with all of my notes, all of my consent forms, all of my charts being closed by 5:15 or 5:30. I don't go home at 5:30 though. So I've set dinner time to be 7:30 every night, and I live 10 minutes from the hospital. So I go to my office and then do work from 5:30 until 7:15. And that's when I address all of the flags that I set up during the day on the emails, because those are things that are going to take me more than 90 seconds so I can get those done. This has allowed me to really kind of, when I leave work at work. So I'm done. I don't even bring my laptop home Monday through Friday.
That's incredible.
Yeah. So that's really been a very helpful thing with regards to clinic. And the nice thing is in clinic, I've got a senior level resident and a PA with me. So the senior level resident will go see those new patients while I crank out a couple of the quick post-op patients or return patient visits or an injection. And then if I'm getting behind because I have a couple of really complex patients that are taking a lot of my time, my PA will keep moving forward and kind of get some of the quicker patients done and through clinic quickly. This gives me the ability to still teach. So I've got the resident to say, you need to focus on these 2 patients this hour. I want you to go think. And it could be something as simple as tendonitis. It could be something as a very complex revision hip. But take some time thinking. I don't need you to do my paperwork. I can write the entire note. I can get MRI scripts and PT scripts, but take some time to step back and think about what you want to do for this patient. So the efficiency is probably one of the biggest things in clinic that residents that come through on my service and people who are not even going into joints, they might be going into spine or foot and ankle or shoulder and elbow. They come back their chief year and say, do you mind if I spend another day with you in clinic? Because I need to remind myself of how you run this efficiently so that everyone feels like they're being seen. You're not in a rush and we're not working hard to keep you on track and on schedule all day. So it makes it a much nicer environment, especially if you're educating someone else and you're not just cranking through. The other trick, Marney, that I think really equates to my OR day is every patient I sign up for surgery in my clinics, they get rated a 1 through 4. So a 1 is a straightforward case that's going to take me less than an hour. A level 2 case is something complex. There's something about this patient that's a little bit tougher. They've got hardware in place. They're obese. They've got a big deformity. or it's a straightforward revision. A level 3 is a disaster. This is going to take me 3 hours. This is a very complex revision. And a level 4 is I need another surgeon. I need plastic surgery to do this with me. I need someone from the tumor service or something. The reason I did this, and I did this literally the first day I started practice, was an ability to communicate with my front office staff. My assistant does not know what any of these cases are, but she knows points, and she knows that I don't want more than 6 or 7 points per OR. That means if there are, 3 level 2s in one room, that's fine. If somebody cancels, she will never put someone in that slot that has a higher point number than was already in there. She can go lower, but won't go above it. That's what keeps my OR really streamlined. So I never walk in and say, why do I have 4 revisions on today? So I'm going to be here till mid. That is probably one of the simplest things I've done. That has been the most impactful, keeping my OR days very streamlined and very reproducible over time.
So I want to delve into this because I think everyone is furiously writing down notes here, but don't worry, folks, it's recorded. You can just rewind it, listen again. Can we go into training your teams? Because for those at academics, the one variable that's constantly in flux in your team is the residents and fellows. They rotate every 3 months. For residents, some of them could care less about joints. Maybe they've already picked hands or spine or something like that, so they're all invested in different ways. Let's first start with how you motivate and train up those residents and fellows so that they get into this well-oiled machine and don't become a cog. And then I'd love to talk about how you've developed the time that you took to sit down with your office staff to really share with them the very critical role that they play in, once again, such a well-oiled machine.
Yeah. So let's look at this 2 parts. So thinking about trainees, whether it's residents and fellows, definitely it's challenging when they're switching over every 6 weeks, every 3 months, and you're starting over every single block to reacclimate the next individual on your service to be a part of the team. I think what they enjoy most is they come onto the service for a 6-week block as a resident, and they see around them a team that is functioning very well despite their presence, in the sense that we're not relying upon the resident to do my pre-op planning and to call all the reps, and without them, my service would fall apart. I have attending surgeons that are partners of mine that literally break down if the resident's not going to be in clinic with them. For me, a resident is a luxury. If you're here, then I'm here to educate you and to give you an experience that is going to be fruitful for you, no matter what you're going into. And so when I have that approach, and I think that perception in my mind of what they represent, they realize that they're just joining a team that already functions well. So that actually takes a lot of burden off of them. And I think that gets them a little bit more engaged, as opposed to, oh God, this sucks. I've already chosen to do spine and I don't want to do another joints rotation. Or this is really great. This might be my opportunity to maybe ask some questions on stuff that I should know because I'm a 4th-year resident that I kind of missed. Or I have a little time to step back and really look at this and say, I need to look at this problem differently than how I was taught to look at it or how I've been looking at it for the last few years. So that's one component of it, right? How do you get them involved? The second part is actually probably more important, right? How do you create the team around you? I think in the office, I'm really fortunate. My PA and my administrative assistant are tremendous. They're really, really great. We sit down every 6 weeks together for a half hour, look at my calendar the next 3 to 6 months out. I'm always extremely responsive to them. They send me a text message and say, hey, Dr. Sheth, can you take a look at this message from so-and-so that came in through the Epic electronic medical record? And my PA knows that the answer I'm going to give her back is, no problem. I already called the patient, took care of it, nothing for us to do. So I'm extremely sensitive to what their needs are. My assistant used to cover one of my other partners, and she would have to send 7 emails and 7 text messages in order for that surgeon to respond to something. Whereas she knows that she sends something to me, it's done. And I'll just figure out a way to get it done because I know then it's off of her plate. It's no longer a burden in her mind. So I think trying to figure out a way that to communicate with your team is very important. And the 3 of us communicate so well together that between the 3 of us, 99% of things are captured. We're not going to miss something that's going to fall through the cracks on a patient and result in a bad outcome. Same thing goes in the OR. I think, one of the things that a lot of people ask about is you start your practice. You're brand new. No one knows you. Teams have been built around you. They've been working with Surgeon X for years. Who's this new guy coming in or new girl coming in? And how do you kind of stake your claim and how do you post a flag to say, okay, I'm the new person in this practice? And I think during that time, you've got to identify people who are willing to change, who are looking for new things, to do things a different way. And if you identify even just one person, you can empower that person to be responsible for building your team for you. Because all of a sudden, they're setting the expectation of what this team requires and what the expectation is of the team. And yeah, I want this person, I want that person to be a part of our team because you guys are so good. And now all of a sudden, they're educating at the next level down, whether it's a scrub tech or a scrub nurse or an RNFA or any level in your OR. But again, you start working with the same mentality and the same outlook for the teams in the operating room. And then the nice thing is that you've got crosstalk between your office staff and the OR team, and everyone's talking. Everyone knows exactly what we're doing for patients on a given OR day.
I love that. As I was sitting there, I was kind of thinking, I wonder how all the group texts I've put you on plays into this. So I apologize. I'll try to trim down the amount of hilarious memes I send over. I'll be honest, I hear so many times from my clinician friends that right now, finding staff is really hard. Finding staff to stay is, sometimes harder. Motivating them can be a challenge. Do you feel like because you've empowered, right? So and I'm just going to jump around a little bit. One of the reasons why I love Ritz-Carlton so much is their training platform empowers everyone from the general manager through the maintenance, person, through the janitor to make a $5,000 on the spot decision to improve an experience. And that simple empowerment gives everyone a sense of accountability, of pride, of ownership. How have you maintained your staff, continued to motivate them, recruit more, etc.?
Yeah, I think, to be honest, though, Marnie, this is hard, right? I mean, I've got some staff who've been with me for several years who are all disbanding at the end of the summer because they've got, life things that have happened that, major changes in their life, and that they're moving to different cities and they're moving to different health systems. And some people are leaving healthcare. I'm not sure you can really counter that today. Right. My mentors in Chicago have had nurse practitioners and PAs who have been with them for 37 years. I don't think that day exists anymore. So I think what you do, though, is, again, empowering people. If people are going to leave, there's going to be this feeling that, well, I'm not going to leave the team high and dry. So I'm going to be continuously looking for that person who's either going to take my role or empower that next person who I think is really good and is engaged and really cares about what you're doing, right, on your service and how you guys are taking care of patients together as a team. That's going to want to step into this role. And that's kind of what's happening for me right now. I don't know how else to do it. I think that it's extremely important, though, throughout the whole process is you've got to be very respectful for people who are on your team, right? They're not there just for your service. You want them to feel like they're a part of something great. To give you an example, Marney, every time I do one of these big revision cases, I send the post-op x-rays to the entire team, the RNFA, the scrub tech, the circulating nurse. Say, guys, great job. This is what the patient's post-op x-ray looks like. And the nice thing is when I walk in the next day and it's the same team in the room, they're just like, Doc, that looks really awesome. Like, was that device that you pulled in at this point of the case, or was that the thing that we pulled off the back table that you used over here? Yeah, this is what it is. This is what it looks like. This is what all the different pieces are. All of a sudden now they're actually they start caring, right? And they're part of the team, and they're like, this, you're not here just for service, right? The only person that actually matters to me in the OR is the person on the table. All of us actually have the same job. We may have different titles and different roles, but our job is to take care of that patient on the table. So you're a part of this team, whether you're the scrub tech, you're the industry rep, anesthesia, whoever it is, anyone in the room, everyone's doing the same thing. Deliver the best care that we can for the patient who's on the table. So I think the more you can do those kind of things, people buy in, because most people don't do those things, right? None of my other partners are doing any of that stuff with their teams to help them feel like, wow, we accomplished this together. This was not just a one-man show.
I love that concept of just sending, no matter what role they played in that patient care continuum, they get to see what the outcome is. Because to your point, your residents, fellows, PA gets to see that outcome when the patient comes back, however many weeks, months, years later. But, very few. So that's incredible. I already think I know the answer to this because I know you. But for the listeners out there, are you waiting until something in the process starts to break down? Or are you prophylactically looking at the process continuously and seeing where you could make improvements and refine
Great
it?
question. So I'm continuously refining my whole entire process at every level. And I'm doing this on a daily basis, weekly basis, definitely quarterly basis. I have an award out to any med student, resident, or fellow that can come up with something to make me more efficient. Any process that I currently use now, And if it's something worthwhile, I will give you $1,000. So far in 14 years, one fellow has come up with something that has made me more efficient. And I wrote him a check right
Who
there.
was that?
Chris Hote, one of our former
Oh,
fellows
okay.
down, I think in Tennessee now. But he came up with a way for me. A small thing, I call all my patients the night before surgery. I had since the first day I started practice. And in the initial phase, I had some senior partners who made fun of me because they're like, he's doing that because he's not busy. Yeah, that's true. I wasn't busy then. But now it's 7 or 8 cases a day. It's just become part of my routine. So I literally call patients on the way home. And the nice thing is that there was something that switched from our Epic app to the Doximity app, and there was a link that this guy showed me, which now allowed me to click on their phone number, and it would call through Doximity, and it looks like I'm calling from the hospital, and I can see their last office note before I called them. I'm like, here's a check for $1,000. Like, this is making me more efficient, because before that, I was like having to look up the number, dial it onto my phone. Like, it was a much longer process. So it's a really good point, though. You don't want to be in a situation where you're putting out fires. You want to prevent the fires from starting. And so by continually fine-tuning any system that you have created allows you to stay current, because things change. There's different, priorities that happen now compared to 6 months ago. And the system you had 6 months ago may not be equipped to handle the priority that's become a priority today. So continually fine-tune your system and keep working at it.
Awesome. I like it. Is that Chris Hote that spells it with a DT
Correct.
at the end? I know that guy. I'm going to give him a high five if I see him at AUKUS. That's incredible. You just listed off one of them. Along with Doximity, what other tools, resources do you incorporate into your practice?
I don't really use a lot of technology. The only things that I really use are I use my Outlook calendar, and I use my email and my calendar. The Doximity is the only piece that I use because it links to Haiku, which is the app for the Epic EMR that we have here at Penn. One of the things, and there's a ton of apps out there that can help you manage your time and tasks and all this stuff. One of the key things, though, for me, Marnie, is I have no to-do list. My entire to-do list is my calendar, and it's my email. If there's something on my email, that means there's something left for me to do. My inbox, as I'm looking at it right now at 4:30 in the afternoon on a Thursday, is 0. So that means everything that I needed to get done is done. Now, I have things on my calendar for tomorrow morning between 6 a.m. and 7 to 8. I'm flying out somewhere tomorrow afternoon. I've got things locked in already that I've got a 4-hour flight. So I want to read Harvard Business Review for an hour and a half, and I need to read this resident's paper for an hour. So I've got slots already built out. If, for example, I sit next to someone interesting on the plane and I decide not to read Harvard Business Review, I will take that and move it to a different slot on my calendar next week, where I need an hour and a half to be able to focus on that. So the point is that I don't even use technology more than those two elements, because that kind of governs my basic tenet of not having a to-do list. And my to-do list is governed by what I'm supposed to do on my calendar. And that should tell me what I'm supposed to do.
What happens if it's, 93 minutes and you're still on Harvard Business Review? Do you set alarms for yourself?
I don't set alarms. One of the things that I did probably about 8 years ago, which was the most important thing that I think I've ever done, which helps me run my system, is I came up with a list of tasks that I normally do. And I actually sat down and figured out how long it takes me to do each of those tasks. And those tasks are broken up into 15-minute increments. So 15, 30, 45, 60, up to an hour and a half and 2 hours. So I usually don't try to engage in tasks that are going to take more than 2 hours at a given time. The realistic thing is, when I started this, I said, whatever I think it's going to take me, I'm going to double the time. And what this has allowed me to do, because I look at this list every 6 months, because again, priorities change, projects change. I have different things that I'm involved in that might need to take priority now, which if I'm spending a lot of time on this, it might take me less or more time, depending on what the actual task is on that list. But what that's allowed me to do is be very deliberate about how I manage my time, attention, and energy. So for me, time management comes down to, you have to know that it's going to take you X number of minutes to do something, assuming you are fully attentive and not distracted and you have the right energy. So for me, getting on a plane tomorrow and sitting down, and I want to read Harvard Business Review, which is more fun for me, and I don't have to be fully engaged like I'm in the middle of doing a surgery. I can sit there leisurely and read this and pick up on some stuff that I want to read about just for fun. That's 90 minutes of time. It's just if I'm in there and it's 93 minutes, I can say, hey, I can look at my phone and say, okay, I was supposed to do something else, but I'm going to move that to tomorrow's flight on the way home. Not critical because I'm really in the zone right now, attentive, and I have high energy of what I'm doing. The key thing, I think, for any listener on this, and I talk about this with all of our trainees because this is what they pick up on the most. I never start a task that's going to take me longer than the slot I have open. And I assume that I have the right attention and energy. If I choose in the first few minutes that I do not, I will not do the task. I will move it to a different slot on my calendar. So if I have to spend 90 minutes to read a first draft of a paper, I'm not going to do that after my seventh case, which was a disaster revision when I'm physically tired, still waiting for them to call me to say that they've closed the wound. I got to go talk to the family. I'm going to be distracted. I'm kind of get out of the hospital to get home. Not the time to sit down because that 90 minutes is going to take me like 3 hours, or I'm going to blow through something quickly and I'm not going to do a good enough job. That's not the right time to fit it in. So I don't have alarms to set off like it's at you've just hit 90 minutes. I kind of get a sense of like, no, but it's actually an important question because how do you keep that? I think keep that within the range of what you want to do. I've just been very realistic with myself on how long it takes me to do something, but I choose those things based off of I'm assuming full attention, full energy, and if I don't have either of those two, I'm not starting the task. That's how people create to-do lists. And then the things on your list keep getting pushed further down because new things pop up that take priority. And that's how that list gets longer and longer.
Do you implement, we mentioned priority and everything. Do you implement any, of the essentialism tips to what you decide? Because I have to only imagine the amount of asks that come your way, whether it's simply mentoring, a med student or a resident, or flying to a different part of the world to give a lecture, or to sit on a board of an organization that one of your friends decides that, she wants to launch. How do you decide what you can do? And then what do you do when you need to say no, that you can't do it?
So great question. So I was part of the FAOA faculty 2 years ago when we were talking about balance, and that was the topic that they were talking about for a 2-day course. And there was a section on how you should say no. And they were going about on how you properly go about, and diplomatically and politically say no. And I kind of raised my hand and I was like, I don't think this is the right message. They said, well, this is the right message. You should, people should learn how to say no. And I said, well, none of us are sitting at this table because any of us ever said no. Otherwise, they would have asked us to be here. I said, shouldn't the message be, why don't you create your system so it can tolerate when you say yes? Figure out what's important to you. I've figured out over several of the books that I've read that I think tasks come into 3 flavors. There are things that you have to do. I don't have a choice. I have to get recertified. I got to do X, Y, and Z in order to get recertified as an orthopedic surgeon. There are things that I do that I think will be good for me because it's good professional development. I'm learning a new skill. I'm practicing a new skill that I have learned or acquired. And the third thing is managing relationships. So when your friend decides to launch something and they say, we'd love you to be involved, absolutely. Right? Because I'm managing a relationship because I respect that person. I respect what they're doing. And right, I'm going to give them as much time as I can. I'm at the stage of my career now that certain things have taken priorities, right? Hospitals in other countries and things that are taking off, so that I can be a little bit more selective and say, I'm not going to give as much time to this because I can't, right? Something else is taking the priority. But I think in the beginning, when surgeons start their career, it's very hard to say no. You're not going to tell your senior boss who asks you to write a chapter and say, I'm sorry, I can't do it. You're never going to get asked again, right? And depending on what your career goals are, you're going to have to do some of those things. But my thought is if you do say yes, figure out a system that allows you to tolerate the fact that you've said yes so that you can do a good job, appease this relationship that you're forming or building with your senior partner, right? You're learning a skill, which is good, which is on how to write a chapter or how to take a resident or a fellow through writing a chapter for the first time for them, maybe, right? And you're not saying no, and you're saying yes, and also working towards, hey, maybe this is a system thing that I've created that might work for something else in my life.
I love it. Well, in light of the topic, and I'm looking at the clock here, I told you I was going to take a very specific increment of your time, and I actually would love to give you 2 emails back. That's how much to give you back on your calendar. So what a pleasure. Thank you so much. I'm sure our listeners took a ton of notes and got a lot of pearls. If you want to learn more about Dr. Neil Sheth and how to build efficiencies, please check out his bio in the show notes. He has some great books and other resources that he's learned from. And I hope you have a wonderful rest of your day, Neil, and thank you so much.
Marnie, thank you so much. Always a pleasure talking to you about anything, but definitely this topic.
Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marney Reid Presents.